Acute lymphoblastic leukemia, ALL, is a type of cancer that affects the blood and bone marrow, characterized by the overproduction of immature white blood cells called lymphoblasts. These abnormal cells crowd out normal blood cells, leading to various symptoms and complications. Here's an overview. 1. What is ALL? Acute indicates the rapid progression of the disease. Lymphoblastic refers to lymphoblasts, immature forms of lymphocytes, a type of white blood cell. Leukemia, a cancer of the blood-forming tissues, including bone marrow and the lymphatic system. ALL primarily affects lymphoid progenitor cells in the bone marrow, which develop into B lymphocytes or T lymphocytes. These immature cells fail to mature and multiply uncontrollably. 2. Who is affected? Children. ALL is the most common type of leukemia in children, especially between the ages of 2 and 5. Adults. It also occurs in adults, though less commonly, and outcomes are generally less favorable compared to children. 3. Causes and risk factors. The exact cause of ALL is unknown, but some risk factors include genetic predispositions, certain genetic syndromes like Down syndrome or Li-Fraumeni syndrome, environmental exposures, radiation or chemical exposures, e.g., benzene, previous cancer treatments, chemotherapy or radiation for other cancers, immune system disorders, conditions like ataxia-telangiectasia. 4. Symptoms. Symptoms arise due to the overcrowding of abnormal cells and the suppression of normal blood cell production. General symptoms: fatigue and weakness, fever, weight loss or loss of appetite. Blood-related symptoms: anemia, pale skin, shortness of breath, increased infections due to reduced white blood cell function, easy bruising or bleeding, including frequent nosebleeds, bone and joint pain, caused by the overproduction of cells in the bone marrow, enlarged lymph nodes, liver, or spleen, due to infiltration by abnormal cells. Neurological symptoms: headache, seizures, or blurred vision if the central nervous system is involved. 5. Diagnosis. Diagnosis typically involves blood tests, complete blood count, CBC, showing abnormal levels of white blood cells, red blood cells, and platelets. Peripheral blood smear revealing lymphoblasts. Bone marrow biopsy to confirm the presence of abnormal lymphoblasts. Immunophenotyping identifies the type of lymphoblasts, B-cell or T-cell lineage. Cytogenetic analysis detects chromosomal abnormalities, such as the Philadelphia chromosome, BCR-ABL fusion gene, associated with poor prognosis. 6. Treatment. Treatment aims to eradicate leukemia cells and restore normal blood cell production. Induction therapy. High-dose chemotherapy to achieve remission. Consolidation therapy. Further chemotherapy to eliminate residual disease. Maintenance therapy. Low-dose chemotherapy to prevent relapse. Targeted therapies. Drugs like tyrosine kinase inhibitors, e.g., imatinib, for specific genetic mutations. Immunotherapy. CAR T-cell therapy or monoclonal antibodies. Bone marrow transplant for high-risk or relapsed cases. 7. Prognosis. Children. The cure rate is high, with long-term survival rates exceeding 85%. Adults. Prognosis varies. Older age and specific genetic abnormalities may reduce survival rates. Relapse requires more intensive treatment and may involve newer therapies. 8. Complications. Immediate: infections, bleeding, and anemia. Long-term: treatment-related side effects, including secondary cancers, fertility issues, or organ damage. ALL requires prompt diagnosis and treatment. Advances in therapies have significantly improved outcomes, particularly in pediatric cases.